for all that we talk about it, and for all its importance, and for all the ways that it matters, hydrogen ions are actually in very low concentrations, right? So, at a pH of 7.4, remember that pH is logarithmic, right? Which makes it kind of a weird scale. But this very, very small amount, that's 7.4. That's a pH of 7.4, which is the body's pH. If you compare that to sodium's concentration, you can see that there's literally like 1,000,000 times more sodium ions than there are hydrogen ions. But hydrogen ions play that significant role with water that creates the acid-base paradigm, right? So if the concentration is very low, the precision and the normal range is very small, the precision of control must be very significant, and it is. The body defends a pH within 0.02 either direction most of the time. Okay, so it's a very narrow range. And in pathology tomorrow, we're going to sort of take these concepts and look at them in disease processes as we look at blood gases together, which is the way that we assess the pH status of a patient. Okay, so to remind you, an acid is a proton donor, a base is a proton acceptor. By proton, I mean H+, right? In case nobody's ever heard that term, an H+ is a proton, right? It's that small of an atom. It's literally a proton and nothing else. So an acid is a molecule that can hold on to, an acid is a molecule that tends to give up a proton. A base is a molecule that can gather one up, all right? Now, some acids and bases are what we call strong acids or strong bases. These substances, when we put a strong acid into water, it completely dissociates. So we get a hydrogen ion and then something else, right? So like hydrochloric acid, right? If we take that, it's a strong acid. If we take hydrochloric acid powder and dump it into water, it completely dissolves, right? So that's a strong acid. Many of the molecules in our blood are not strong acids. They fall into this category of weak acids and bases. These are molecules that sometimes accept a proton and sometimes give up a proton, depending on what the pH is, depending on how many protons are around, right? Because remember, in the end, pH is telling you what the concentration of protons, hydrogen ions, is, okay? So weak acids and bases can be kind of paired together to form what are called buffer systems. This is where we have multiple molecules that, because of how they give up or accept a proton, these are molecules that tend to keep pH stable even as we add acid or add base, right? You for sure worked with buffers in Gen Chem, okay? Now, thankfully, this is not a Gen Chem class. I'm not going to ask you to calculate the pK. I'm not even going to ask you to know how to calculate the pK, okay? Rather, we are going to look at how these systems of weak acids and weak bases are used by the body to stabilize pH. In other words, we're not going to look at how the buffers function or how the molecules function. We're going to look at how the body uses them, okay? All right, so if we look at fluids of the body and their pH, okay, this is the standard, 7.4. What is the normal pH of blood? 7.4. Now, and that's arterial blood leaving the lungs. Okay, so that's the best blood there is, right? It's as basic as it comes. Once the blood passes through a capillary bed, it's going to get acid added to it, right? So you're going to see the pH fall. Please, please, please remember that a lower pH is a higher hydrogen ion concentration. It is a very common relationship that students get mixed up in their heads, and then you make mistakes about it. So whatever it takes for you to think about it, have a reminder that a lower pH is a higher hydrogen ion concentration, okay? So as we go from arterial to venous blood, we cross a capillary bed. That is, we're going to add acid to it. So we're a little more acidotic. Our blood's a little more acidic when it leaves the capillary bed in the veins. Interstitial fluid is about the same, 7.35. Intracellular fluid varies. It depends on how busy the tissue is. The intracellular fluid tends to be less than 7, all right, because we vigorously produce acid. The 7.4 is going to be a cell that either isn't very busy or happens to be producing base of some kind, like our intercalated B cells. Now, urine, we've been talking about the differences between plasma and urine for a week now. In terms of pH, the urine can be high or low. All right, this is going to be determined by the intake of the patient. Right? If you are taking in a lot of acids, well, guess what? It has to go somewhere, right? So your urine will be more acidic. If you're taking in a lot of bases, your urine will become more basic, right? So, if you have somebody who is fighting off heartburn, let's say, and they're popping Tums all day long, well, their urine's going to be 9.0, right? Because they've got all that excess bicarbonate that they have to get rid of. Now, on the flip side of things, we can make really, really strong acid. We do so in the stomach, and you can see here the concentration of acid is even higher than that of sodium, and we have a pH of 0.8. So that is a very potent acid. That's our hydrochloric acid that we make in the stomach. We have high acidity in the stomach for a number of key reasons, but it's actually a good